I do everything. I do endoscopy and colonoscopy. That's, the majority of the procedures that I do are those procedures, both for screening purposes, for colon cancer screening, and to diagnose a whole variety of problems. And that also gets into my interest in inflammatory bowel diseases like Crohn's disease and ulcerative colitis. We do those procedures many times to diagnose or help treat those conditions. And then I also do a couple other things. I do capsule endoscopy, which is a pill camera. That's a test to look at the small intestine. You come in the morning and a nurse will give you a little kind of device to wear on your belt for the day. And then they'll give you a pill to swallow. And it's the only pill you're ever going to swallow that has a flashing light. So you swallow the pill, and they'll watch you for a few minutes, and then you can go. You can leave the facility and go about your business for the day. And you'll come back at the end of the day, like in the afternoon, and just hand back that beeper type device, the belt device that you wore for the day. The pill is a one-time use thing. You just kind of poop it out and it'll go down the toilet. And then we'll take the video that the pill records and sends to that device, and we'll watch it and just watch the footage of the whole small intestine as the pill passes through. So it gives us a chance to see the whole length of your entire small intestine and find any problems. Sort of the middle part of the small intestine that we don't usually see on endoscopy and colonoscopy. And that can be helpful for many different conditions, both those that I mentioned and some others too. I also do chromoendoscopy, which is it's a type of colonoscopy. It's a way to look at the colon and identify minute changes in the tissue of the colon that might lead to cancer down the road. And it's particularly useful in patients with inflammatory bowel disease. I diagnose and treat a wide variety of liver diseases too. And I did some special training in liver disease in terms of research. At GANJ, we manage sort of the routine things that come up in liver disease. And we also have wonderful connections with a lot of the advanced liver doctors in the tri-state area. So if a patient comes into GANJ and has more advanced liver disease or something that requires an evaluation for liver transplant, we have sort of direct lines to the big experts in all the big transplant centers in New Jersey and New York. So, we do manage a variety of liver disease, but we also have that pipeline to the people who deal with the really complicated and sophisticated things on a university level.